Okay guys, so celiac disease. Now, high yield point for celiac disease, important for exam, you need to know this one. So this is sensitivity to gluten. You must know gluten. So exposure, chronic exposure, repeated exposure to gluten will cause villus atrophy, and that will lead to malabsorption. So in terms of clinical features, very, very important. So therefore you can diagnose this condition. This patient will have chronic diarrhea. Remember, this diarrhea, there is no blood in it. They will have weight loss. But don't get confused, it's not bowel cancer here. These patients will have offensive, very bad smelling stool, fatty stool. Okay? So it's not IBD, it's not IBS, it's not your colon cancer, it's celiac disease. So you will have a history of sensitivity to gluten. In terms of complication, two things. Osteoporosis, you need to know for exam, and T-cell lymphoma of the small intestine. Now, moving on to investigation. Very, very important, guys, they ask you. There is the initial investigation and diagnostic investigation. Initial and diagnostic. You need to know both of them. Many people get confused between the initial investigation. There's two things. There's autoantibodies, but there's two autoantibodies, you see. Tissue trans glutaminase antibody, IgA, and endomycin antibody, IgA. So these are the autoantibodies. These are the initial investigation. If you have both of them there, you pick the first one. Tissue trans glutaminase antibody, IgA. Diagnostic is going to be biopsy, duodenal biopsy. So with regards to deficiency, this patient can have deficiency of iron, so it can cause microcytic anemia. They can have deficiency of folate, it can cause macrocytic anemia. So celiac actually can cause deficiency of folate and vitamin B12, but folate is more common. So don't choose vitamin B12, choose folate because it's more common. So two things, iron deficiency anemia can be so it can cause iron deficiency or folate. Okay. Investigation, initial and diagnostic. Diagnostic is going to be duodenal biopsy. It's going to be the diagnostic one. With regards to treatment, gluten-free diet. Very simple. One small thing can put you off. If a patient wants to be tested to see whether they have celiac disease, and for the past, and they've been sort of, free of gluten diet. So imagine they've been trialing a food free of gluten. So gluten-free diet. Now they want to be tested for celiac disease. It's important that they reintroduce gluten in the diet for 6 weeks before being tested to prevent false negative. So celiac disease, super important, guys. Hope you enjoyed it.